There are nurses who specialize in helping survivors of domestic and sexual violence on the worst day of their lives. But advocates say we don't have nearly enough of them in Clark County. In fact, Washoe County, which is less than a quarter of the population of Clark County, has more. I'm Anjali Patel, getting an inside look at the problem and what's being done about it.
Enough is enough. 120 a month.
SafeNest CEO Liz Ortenberger says her organization sees on average about 120 strangulation victims per month, a staggering number. And she says the Valley simply does not have the resources to support them.
We as a city and as a county have got to grow into the space of being able to provide the appropriate victim services.
Forensic nurses, and more specifically a sexual assault nurse examiner, or SANE, are few and far between in Nevada's most populous county. These nurses are specially qualified to examine survivors of domestic violence and testify about their findings in court. But in Clark County, UMC is the only hospital with a SANE program, and it only has one primary SANE. A hospital spokesperson says two others fill in from time to time if the primary one is not in. In total, they conduct about 60 to 100 sexual assault exams per month, each one taking an average of 4 hours to complete.
A survivor has a couple of options. One is to go and wait in the emergency room at UMC for the time that it takes to get the exam. I have reports of people waiting 4 hours. I have reports of people waiting 18 hours.
The other option is to decline the exam, and their abuser may never be brought to justice.
That's woefully inadequate. That is just, I was just sort of shocked when someone told me that. Most places have at least one, or this size, most places the size of Las Vegas would have at least a couple of different teams at different medical centers.
UNLV Director of Doctoral Education Candace Burton previously worked as a forensic nurse in several states.
We ask the person to show us what happened. So were they strangled like this? Were they strangled like this? Were they strangled like that?
She says it's a tough but necessary line of work.
We have a nationwide shortage of nurses. Forensic nursing is a difficult specialty, so the shortage within our practice is even greater. And the fact that it's difficult sometimes to get teams set up. This is not exactly a money-making practice. We're not doing like outpatient surgery or something, you know, because the state pays for the exams.
She says she started a forensic nurse training program in another state. So I asked her if she'd be interested in starting one here.
We are talking with SafeNest, actually. This just kind of came together as a result of you contacting me, in fact.
She and other partners are exploring potential grant funding to possibly start a training program here. But there is no one simple solution. The SafeNest CEO says Nevada also needs to streamline how providers can bill the government for these exams, since they're free for patients. And she thinks any hospital that receives Medicaid dollars should be required to have a forensic nurse on staff. Two things on her legislative agenda for 2025.
We can be the entertainment capital of the world. We do not need to be the #1 place for people being abused.
I reached out to two of the other largest hospital systems in our valley to see if they're thinking of starting a SANE program to help take the load off UMC. A spokesperson for Dignity Health said given the training, legal, and financial requirements for something like this, they've opted to endorse UMC's program. And a spokesperson for Valley Health System said they're not exploring this at this time. Reporting for Channel 13, I'm Anjali Patel.